On Plugged In, the President of the United States infected with the coronavirus.
I didn't feel so good.
He seems to be doing well, but until 7 to 10 days have passed, he's not out of the woods.
We examined the President's treatment, the impact of his hospitalization on national security, and on the presidential campaign inside a month to Election Day. On Plugged In, COVID in the White House. Hello and welcome to Plugged In. I'm Greta Van Susteren reporting from Washington. The coronavirus penetration into the White House adds another bit of anxiety in an already momentous year. President Donald Trump and First Lady Melania Trump are atop a list of at least a dozen top government officials who attended a White House event on Saturday, September 26th. Many of the attendees were not wearing masks. Less than a week later, both the President and First Lady tested positive for the coronavirus. In between, President Trump and former Vice President Joe Biden held their first debate, signaling the start of the final stage of the 2020 presidential election campaign. VOA senior White House correspondent Patsy Widakuswara has the latest.
Upon returning to the White House Monday evening, President Donald Trump took off his mask and urged Americans not to be afraid of the virus.
And now I'm better, and maybe I'm immune, I don't know. But don't let it dominate your lives. Get out there, be careful.
Trump had no public events scheduled at the White House on Tuesday, but has been tweeting frequently. Some of the tweets downplayed the threat of the coronavirus, the same message that he conveyed in the video of his discharge from hospital.
I don't think it's meant to do anything to advance the public health messaging that his own administration is attempting to do. It is, as it often is with this president, a display of what he thinks strength looks like. But of course, we know that there were some hiccups there as well. Close-ups of the president, for example, found him to be breathing rather heavily.
On Tuesday, the White House released a statement saying the president's vital signs are stable and that he reports no symptoms. Public health experts say that this does not mean he cannot transmit the virus to others.
Generally speaking, people with mild illness are no longer contagious by day 10. So first and foremost is if somebody is contagious with COVID-19, to stay self-isolated to protect those around you.
Meanwhile, the White House has become a virus hotspot, noticeably emptier than normal as some staff work remotely. Other than the President and the First Lady, there are at least 11 White House and Trump campaign staffers who have tested positive, including Press Secretary Kayleigh McEnany. That number does not include undisclosed infected lower-level staff and Secret Service agents. At least 11 people who helped with the presidential debate last week have tested positive, as well as 3 Republican senators, 2 religious leaders, and 3 journalists who may have been infected during a White House ceremony on September 26th that has become a potential coronavirus superspreader event. The White House says contact tracing is underway. The administration faces criticism for involving neither the Centers for Disease Control and Prevention nor the municipal government of Washington, D.C., where many staffers reside.
Looking backward is important, particularly for super spreader events, because knowing who the source was for an infection can help identify where other transmission patterns could have happened. In other words, knowing where President Trump was exposed may be important to identify other people who may have been exposed at the same time.
The First Lady's office released a memo on Tuesday outlining precautionary measures including full personal protective equipment and daily testing for staff working in the residential part of the White House where the first couple is recovering. Trump has just over a week to get well before he is scheduled for a second debate with Democratic presidential nominee Joe Biden on October 15th. Trump tweeted he is looking forward to it. Patsy Widakuswara, VOA News.
The Centers for Disease Control is the lead U.S. government agency fighting the pandemic. Dr. Tom Frieden was the CDC director during the Obama administration. We discussed the president's prognosis and the importance of a comprehensive approach to treating COVID-19.
He's a 74-year-old man who fits into the category of obesity, given his weight. And he's gotten oxygen, which is standard, remdesivir, which is commonly given to hospitalized patients and may reduce how long they're sick, a new experimental treatment called monoclonal antibodies, or a cocktail of monoclonal antibodies. And that's a promising treatment, but there are only a few hundred patients who have ever been described with it. Very few who have also gotten remdesivir. And then dexamethasone, a steroid, which is usually given late in the course of illness to people to cool down their immune system when it's the immune system making you sick, not the virus itself. I think that basically means you've taken all of the most promising or demonstrated treatments and given them to the president. He seems to be doing well, but until 7 to 10 days have passed, he's not out of the woods. And it emphasizes that this is a very serious infection that can easily be fatal, even though most people will fully recover.
Are those drugs readily available to everybody? I mean, he's president of the United States, but if I got sick or you got sick or somebody else on the street got sick and went to the hospital, are those drugs readily available?
Let's take them one by one. Oxygen. This is readily available in the United States. It's not nearly as available as it should be around the world. And that's not just for COVID. Oxygen is important for adults with pneumonia. It's very important for newborns who may need it just for a few hours to escape brain damage that may affect them for their whole life. So oxygen is something globally that we need to increase the supply of. Second is dexamethasone. It's a steroid. You can use other steroids. They're widely available, inexpensive. Third is remdesivir. There isn't enough remdesivir around, and there are challenges and problems with its manufacture and supply, so that's certainly a problem. And then monoclonal antibodies, that's not even on emergency use authorization. That was something that was gotten directly from the company, so that's not something that's widely available. Remdesivir in the US is getting much more widely available, but the monoclonals, not yet.
Remdesivir was originally developed to address Ebola on the African continent. It turned out not to be successful. So what was it, just put on a shelf for all these years, for a couple years?
Interestingly, for many medications, there's a whole field of repurposing medicines. They might have been made for one thing, but it turns out they work really well for something else. And that's a good example of innovation in a way that doesn't mean discovering something new, but discovering a new way to use something old. Dexamethasone, though, is the only one of those 4 treatments that's actually been proven to reduce the risk of death. And if you take an average of someone who's 74 years old, their risk of death is about 3% if you have everyone infected, about 10% if you're looking at people who have symptoms. And if they are required to be hospitalized, and it's not clear that the president required hospitalization, that risk would go up to about 25%. It's higher for males than females. It's higher for people who are obese than non-obese, but it's lower with good treatment, including oxygen and dexamethasone.
But the good news for the African continent is I've seen that it has sort of beaten the early COVID-19 predictions.
Well, there are a lot of things going on. One is they're a lot younger, and this is a disease that really hits old people hard. Second is they're doing a better job. We've worked in my organization, Resolve to Save Lives, with several dozen countries throughout the continent. They've had organized incident management responses. They've had very well-structured contact tracing and testing programs. They've had good community buy-in for mask wearing and reducing some social interactions that reduce the risk. But they're not out of the woods yet. They still could see a bad outbreak, as has happened in parts of South Africa and elsewhere.
Is there still a whole lot more to know about the coronavirus? Are we still like just in the early stages?
We're still learning an enormous amount about this virus. We still don't know why some people get so sick and other people don't. We don't know why kids rarely get severe illness, or why the severity of illness increases dramatically the older you get, or why men get sicker than women. And we don't yet know if there's going to be a safe and effective vaccine, which would be very important. But what we do know is that there's a lot that we can do to control it. And some of it is pretty straightforward. Wear a mask. Quickly find the cases, isolate people from the moment they're infectious, find their contacts, warn them that they've been in contact. They can quarantine so the virus cannot spread past them. There's a lot that we can do, even though there's a lot we don't yet know.
Doctor, thank you very much, sir.
Thank you. Great speaking with you again.
At least 3 journalists who cover the White House tested positive for COVID. Steve Herman is VOA's White House bureau chief. He was aboard Air Force One covering President Trump's campaign trip to Minnesota the day before the president tested positive.
I had a unique situation last week. I was on Air Force One on Wednesday for the round trip to and from Minnesota, which was the flight that Hope Hicks, a key aide to the president, counselor to the president, she apparently started feeling ill on that flight back from Minnesota to Joint Base Andrews. And there's also some information that the president may have been under the weather as well on that flight back. So I had been tested for COVID that morning here at the White House before we got on the flight. And then I was supposed to cover former Vice President Biden's campaign on Friday, going from Delaware to Michigan. And the Biden campaign required us to get a test in Wilmington, Delaware, the evening before. I did get a test. It was negative. We got the results within about 15 minutes. And then a couple hours later, we got the news about Hope Hicks. Well, that was before we knew that the president was COVID positive. I informed the Biden campaign, which was understandably nervous, even though I had tested negative, and a decision was made that I should not travel with the vice president on Friday out of an abundance of caution.
When you talk about tests, are you talking about the rapid test, what's it called, the antigen one, or the PCR test? Because the antigen one, I think it's fast,
Yes.
but it's thought to be less accurate.
Correct. It is a quick and painless test. I've probably had it nearly 20 times now. And it's just sort of a swab tickling both of your nostrils, and they're able to get the results fairly quickly. And if you were to test positive from that, then there would usually be, especially in the case of somebody like the president or White House staff, a second, more accurate test that would take longer to process.
What if you have an event like there was a debate last week between President Trump and former Vice President Biden. It was in Cleveland, but a lot of people met at Andrews, and they flew on Air Force One, and there were a lot of guests taken to Cleveland, Ohio for the debate, and then nobody was tested apparently from Air Force One in Cleveland, but were some tested at Andrews? Do you know some of the guests?
Those reporters who would be in the travel pool would have been tested that morning here at the White House before going out to Andrews and then riding along on Air Force One with the president.
I take it if you're tested in the morning in the travel pool and you test negative and they say we're going to leave at 4 o'clock for Andrews, that you're mixing with everybody else. You're not like cordoned off in some particular area, but you're now mixing with people.
There is a risk to that, definitely, Greta.
Less than 2 weeks ago, there was a big event at the White House in which the president made a formal nomination of a judge to the U.S. Supreme Court, and there were a lot of people there, and now several people who were there have tested positive for the coronavirus. Were those people all outside the whole time, or were they inside the White House?
Yes, some of those people were inside for a period of time, but for most of the time, they were sitting outside. Most of them were not wearing masks, and they definitely were not socially distanced.
In general, where we are now with the situation, the president having been sick, his close person Hope Hicks, the press secretary, and we go through a list of people who've gotten sick in the last 10 or so days. Kellyanne Conway. Are journalists on edge covering the White House?
Well, I think there's been a degree of nervousness for a number of months, and we have taken precautions. That's one reason we have been very vigilant about wearing our masks when we're in the White House. And there's been a bit of friction during the pandemic between the White House and the White House Correspondents Association. The White House Correspondents Association decided to reduce twice the number of seats in the briefing room. But the White House decided to let a couple of other reporters who aren't part of the Correspondents Association to just stand in the back of the room and ask questions. And when they weren't wearing their masks earlier on, that did cause some friction and concern. And the Correspondents Association, Greta, I should also say, has made very strict protocols for what happens when we come in to the West Wing of the White House that we have to wear masks at all times and we should not congregate together. That wasn't the White House that decided that. And we're wearing these masks to protect everybody, including the President of the United States.
Steve, thank you very much.
My pleasure, Greta.
Messages of concern and prayer poured in from world leaders when the president's diagnosis was announced. More from VOA's Mariama Diallo.
World leaders are reaching out to President Donald Trump after he said he and his wife have contracted the coronavirus. The head of the World Health Organization wished the couple a speedy recovery.
Overnight, we heard that the President of the United States of America, Donald Trump, and First Lady Melania Trump tested positive for COVID-19. I want to start today by wishing them both a full and swift recovery. Our prayers are with them.
Addressing the media at the end of the two-day European Union summit where leaders discussed the virus and its impact on the economy, German Chancellor Angela Merkel.
Meine Damen und Herren, wir haben einen sehr
I would like to use this opportunity to wish U.S. President Donald Trump and his wife Melania a very full and speedy recovery as quickly as possible from their COVID-19 infection.
Mexican President Andrés Manuel López Obrador did the same.
I take this opportunity to wish the President of the United States and his wife a quick recovery.
The Kremlin released a statement saying Russian President Vladimir Putin sent a telegram to the White House. In the statement, Putin writes in Russian, "I am sure that your inherent vitality, good spirits, and optimism will help you cope with the dangerous virus." In Nigeria, many newspapers reported Trump's coronavirus infection on their front pages. Abiodun Ayinde, an accountant and tax expert in Lagos.
All of us have to be careful. No one is immune. American presidents contacted, so we have to be careful. Stay safe. Use face mask.
Mariama Diallo, VOA News.
Despite the well wishes, there is always concern that enemies will try to take advantage when the U.S. president is ill or hospitalized. Pentagon officials reassured Americans that the U.S. military stands ready to defend the country from any threat in the wake of the president's COVID-19 diagnosis. I spoke to VOA Pentagon correspondent Carla Babb on what the president's health means for U.S. national security.
Well, we were issued a statement within hours of finding out that the president had the coronavirus. He had tested positive for COVID-19. We were actually told that there had been no adjustments that needed to be made at the Pentagon because the system that we have set up, while it is a delicate system for our defense, it can withstand one person getting sick or something happened to one person. And they just wanted to reassure the American public and the world and our allies that everything was going okay.
In terms of the Secretary of Defense traveling, when the president travels on Air Force One, the whole White House essentially goes with him. He's got a full office and he can do business right from Air Force One. Is the same true for the Secretary of Defense when he travels? Does he essentially have everything he needs as though he were back in Washington in the Pentagon?
That's exactly right, Greta. He has everything that he needs. I've traveled on that plane that he travels on many times. He traveled on a plane called the E-4B that pretty much allows him to have all of the communications, the classified communications that he needs. If there were a nuclear war, he could actually continue refueling and staying in the air over and over and over again if needed. So he was perfectly capable of carrying out his duties and continuing everything. The one thing that was concerning that some officials had raised concerns is that the vice president was continuing to go out on the campaign trail. And because coronavirus is still so fresh and new and you don't know what's going to happen, even though the president seemed to be getting better, they were concerned because the president has to handle the nuclear codes. And should something happen and he have an emergency and he lose consciousness, you would need that vice president to be there. Vice President Pence would need to be near the nuclear codes, or the nuclear codes would need to get to him as soon as possible. And that is why we have seen potentially delays in telling how the president is being affected by coronavirus. That's not unusual, and that's not necessarily not being transparent. as long as they continue to update the American public. Because, for example, if he were to lose consciousness and the vice president was not nearby, if our adversaries found out about that, that would be an advantage to our adversaries, a real advantage to our adversaries. So the U.S. doesn't want that to happen.
Does Secretary of Defense typically wear a mask? Where is he on this?
So when I have seen the Secretary of Defense, and granted, I have been reporting from afar, so I've only been seeing him, but he has been walking up to the podium whenever he's done town halls or whenever he has spoken, and he will sit down, social distance, and then he will take off his mask. That is very reassuring, I'm sure, to all of the U.S. service members out there who want to make sure that he doesn't catch COVID-19 as well. It's more. But the thing with the mask is it's not just to protect you, it's to protect all of the people around you as well.
Do you have any sense that they are worried about national security as the result of the president being hospitalized and having COVID-19? Or is it that everyone is just reassuring everything, it's business as usual, we need not fear national security risks associated with the president's illness?
It very much is business as usual, very much so, because as I said, the situation that we have, the protocols that the U.S. has in place to transition power is easily withstood when one person in that chain of command gets sick. We've seen this with presidents before, and clearly if the president were to lose consciousness or everything, there would be a way to hand over power. This happens all the time. President Bush had a colonoscopy and was able to hand over power in the past to his vice president while he was under anesthesia undergoing that procedure, and then handed it back immediately after that was finished. So there hasn't been any sort of worry at the Pentagon at all. Once the negative tests kept coming in, everything really has been business as usual.
Carla, thank you very much.
Thank you for having me.
President Donald Trump joins a growing list of world leaders infected by the coronavirus. British Prime Minister Boris Johnson tested positive for coronavirus in March. After spending more than a week in self-isolation, Johnson had to be hospitalized and was close to being placed on a ventilator before recovering. Brazilian President Jair Bolsonaro tested positive in July, and he recovered after 3 weeks. Elsewhere in the Americas, the presidents of Honduras, Guatemala, Bolivia, and the Dominican Republic all tested positive. Prince Albert of Monaco was the first head of state to publicly admit testing positive. In Africa, the vice presidents of Gambia and South Sudan are among government leaders infected. Actors Tom Hanks, Dwayne "The Rock" Johnson, and Idris Elba are among Hollywood figures who battled coronavirus. President Trump's COVID-19 diagnosis comes at a critical moment in his campaign for re-election. I spoke to Rick Klein, political director for ABC News, about how the president's health is impacting the 2020 presidential campaign.
Well, it makes the only issue for the foreseeable future COVID-19, which that's what Joe Biden has wanted to focus on, and in particularly what he views as the president's mismanagement of this crisis. That's a favorable issue set if you're Joe Biden. Less so for President Trump. Clearly, the messaging around the country being about to cure this, being out of the woods, is hurt when he personally is infected. That's why I think you see him trying to project an image of strength, of optimism, of security from the virus that is probably not totally in keeping with the reality at the moment. So this becomes the big thing.
All right, the debate next week, though, it's a town hall. Is there any thought of sort of changing what it was planned and maybe not have a town hall or doing it virtually? Have you heard anything about that?
Yeah, everything is on the table is what we've been told. I mean, we remember just a couple days ago, we were talking about rules changes because of that debacle of the first debate that we all witnessed. Now it's a lot bigger than that. The vice presidential debate is going to have a piece of plexiglass that's put up at the request of Kamala Harris's campaign to keep them physically distanced. There'll be extra precautions there. And then, yeah, the point that undecided voters would put themselves in potential health jeopardy by showing up is something that is relevant. The Commission on Presidential Debates, which organizes these things, Greta, they're putting everything on the table in terms of going virtual, in terms of questioners, or part virtual, part in person. Much different than we've seen in the past, but I think probably prudent given where things stand.
So many people talk about the mask as a political symbol. Is the mask now a political symbol?
It's become one, and I think it probably was one already, given the president's complicated relationship with the idea of wearing masks. But the way that he dramatically took the mask off in showing up on the Truman balcony after being discharged at Walter Reed, I think solidified it. And then you see Joe Biden turning back with his town hall hours later, saying, "Come on, this is not a question of patriotism. Do the patriotic thing and put it on. This isn't about being macho." And he's on social media dramatically showing that he's wearing a mask. We saw just a week ago at that debate, Joe Biden was being mocked by President Trump for wearing a mask. It is an important divide. I think it's a cultural divide as well as a political divide in the country right now. And Biden's calculation is that Americans understand masks as a simple gesture of personal responsibility. For President Trump, it's a lot more about personal liberty. And he has emphasized throughout that he doesn't want it to be a requirement. Joe Biden has said, "I want a national mask mandate. I want every governor to mandate this in the country." So it's a clear division. It's not just a policy difference. Again, I think it's sort of a cultural and attitudinal difference between the two candidates.
A lot of people are watching this race, and they're hearing about the coronavirus. They hear us talk a little bit about healthcare, not a whole lot, the economy as it relates to coronavirus. But the one topic that we're not hearing a lot about, and that's foreign policy and how it affects other nations. Do you expect that between now and Election Day, we're going to hear more about what the U.S. foreign policy is between former Vice President Biden or President Trump, or do you think it's just going to be coronavirus, maybe the economy, and healthcare?
Yeah, frankly, I don't think it's going to be a huge topic. I'd be surprised if it doesn't come up in the remaining presidential debates if they happen, either that town hall debate or the final debate, which is, again, all the topics on the table. So the president, obviously, as commander-in-chief, runs the foreign policy. I think, though, short of world events crashing into the campaign, it's going to be very hard to muscle out COVID, the economic crisis, the crisis around race that we've experienced over the last couple of months. These are huge domestic issues. They have foreign policy implications. And of course, there are vast differences to how Joe Biden would operate as president versus Donald Trump as president. But I don't see it becoming top of mind for voters again, unless there is some kind of an international crisis, unless there's armed conflicts breaking out or some other way that the U.S. gets drawn into something. I don't see the issue set changing naturally in that direction.
The election is less than 30 days away, and you'd think that, there's just so much that can happen in the next 30 days, even because so much has happened in the last 7 days. This is really a roller coaster ride for the United States.
Oh, it's wild. I think, the pace of these earth-rattling developments is unprecedented, and it's happened at a time that Americans' lives are just directly disrupted. People are changing the way that they live. They're changing the way that they vote by necessity. Often legal changes are buttressing that. It all adds to the monumental uncertainty in this country. When you have both candidates saying this is the most important election of a lifetime, they're suggesting not just that the future of policy is at stake, but in varying ways the whole fate of the United States at stake. However you feel about that, there are a lot of people that believe that in this country. We are going through a racking moment, a really divisive and ugly moment often, a moment of a real potential pivot point in American history, the stability of democracy. All of these things are coming into play at the same time. Greta, I never thought I'd live to be able to cover an election quite like that. You have to go back a long time, I think. Maybe to the Civil War, maybe to the Civil Rights era to find anything even roughly comparable. This is a really tenuous moment for this country, and to have this political campaign play out against that backdrop is an extraordinary thing.
Rick, thank you.
Thank you, Greta. Great to be with you.
That's all the time we have for now. Thank you to my guests, Rick Klein of ABC News and former CDC Director Dr. Tom Frieden, and VOA correspondent Steve Herman and Carla Babb. Stay up to date with our website, voanews.com, and follow me on Twitter @Greta. Thank you for being plugged in.